Good morning, everybody. For those of you that don't know me, I'm Antoinette Gravel-Willette, and I'm the Mom Stop the Harm Stronger Together Canada Program Coordinator. And I also oversee and take care of the Connect sessions, which is what we're doing today. So thank you for joining us for the Hope Connect session on language and stigma. I would like to start today with a land acknowledgement. I would like to begin by acknowledging the Indigenous peoples of all the lands we are on today. While we meet today on a virtual platform, let us take a moment to acknowledge the importance of the lands which we each call home. We reaffirm our commitment and responsibility to care for the lands and to strengthen relationships between nations, to improve our own understanding of local Indigenous people and their unique histories, homelands, languages, cultural practices, and spiritual beliefs, and how we can each move forward together in a respectful and meaningful spirit of reconciliation and collaboration. Next, I would like to introduce Susie McPherson. And Susie is our Indigenous liaison to open us in prayer. I can't quite hear you, Susie.
Good morning.
Can others hear? No.
Hello?
You're really quiet. I'm not sure.
Can you hear me?
That's a little bit better. If you could speak loud.
Yeah, I'll go right close here. I'll start with some words in Cree. Isamandu kinanas kamatinan anos kagisaga. Sawenaminan kaminopimatsia. Wichihinan kanawenaminan kakinoninanan kitwasamasa. Wichihinan kanawenaminan anos wabake gamadahtugisagaw. Minanan inanusawen egomenomachi hoen. I want to acknowledge and give thanks for the Indigenous nations that were and are here on these lands. I want to acknowledge the 600 plus Indigenous nations that were here on these lands prior to European contact. Unique and distinct societies that had their own languages and their own systems of governance, that saw themselves as a part of creation and lived as such, always mindful of the generations to come. We look to the east, the south, the west, and the north, and we acknowledge the ancestral story, truth, and wisdom of all the nations. Who are a living, surviving, and thriving peoples. We think about how the story unfolded over time, and we turn full circle back to the east. And we acknowledge the nations who now call this place home. Those who came as refugees, newcomers, settlers, guests, visitors. And we acknowledge each and every one of our stories that contributed to society the way it is today. And we give thanks. I give thanks for each one here, for the story, for the journey that each one of us have been on, for all that we hold, our experiences, and our individual lives and journey to this day. And we give thanks. And so I say, Egwasane nananaskamon, gahkinonawakamaganak. Thank you. I am grateful. All my relations.
Good. Thank you, Susie. Just to give you a little bit of more heads up on the process, I'm going to next introduce Tyler Savard, who's our Acting Director of Operations and Stronger Together Program Manager. And then from after Tyler speaks, then I'm going to go through an overview of how the rest of the morning or afternoon, depending on where you are, is going to unfold. Tyler.
Well, happy Saturday, everyone. Really glad that, thank you to our panelists for coming and joining us today, as well as for everyone that's tuning in, whether it is live or on the recording. It is so awesome that we have this technology at our hands that we can, make things happen, come together from all across Canada, and yet keep the momentum happening and sharing the information. So thank you definitely everyone for participating at whatever time zone you are. So as Antoinette said, I'm the Acting Director of Operations for Mom Stop the Harm, as well as the Stronger Together Canada Program Manager. So our team, I bring greetings as far as from our team, which is not only on the Canada side, but as well as our BC side. It's only because we have different streams of funding that we have the two teams, technically two teams, but at the same time, we are all one team. So we make Stronger Together support, that programming support happen all across Canada, literally coast to coast in every which way. So we have an amazing team that work really hard every day to connect with all of our members and non-members and just our communities within Canada, no matter how large or small. We make sure that we're making those connections happen, as well as bringing greetings from the board. I'm not sure if any of our board members were able to join us today as far as our participant, but definitely I know that they are definitely all hardworking behind the scenes and, out in front. And I know Katie is, one of our board members. And so anyways, we have lots of things always happening with Mom Stop the Harm. So thank you very much for joining us today. It is wonderful to be able to come together and just, make things happen in every which way.
Thanks, Tyler. So for today's format, I'm going to, in a moment, I'll introduce the speakers. So I'm going to read a bio for each of our speakers. And then each speaker will talk for about between 10, 12, 13 minutes to share from their lens and perspective. Anytime during the sharing, if questions come up, feel free to put them in the Q&A. And once all of our panelists have shared, then we'll be starting to take the questions from the Q&A. And the other thing is that if you would like to put in where you are calling in from, it's kind of interesting to note. Our speakers, Daniel, if you want to just kind of give a wave. Daniel's joining us from BC. Dee, if you want to give a wave, Dee is joining us from Manitoba. And Katie, give a wave, and Katie is joining us from Nova Scotia. So our panelists are joining us from right across the country. So we know that this topic that we're sharing and talking about is happens all across Canada. And so I'm very thankful that we have so many people joining us from all across Canada to learn and to ask questions and to be able to share with others afterwards. So thank you. So I'm going to start with Daniel. And so Daniel Snyder is a passionate recovery and harm reduction advocate who's married with 2 kids. He likes to play poker and chess, spend time in nature, in the gym, and travel. Daniel focuses on his personal story of overcoming addiction, advocating for drug policy change, and reducing stigma surrounding substance use and the current ongoing toxic drug poisoning crisis. Daniel spent many years addicted to heroin and survived overdose. His path to recovery featured many ups and downs and benefited from both a strong recovery approach and harm reduction principles in tandem. Today's Daniel's message is to offer hope to those who are still struggling with substance use and their loved ones. Daniel is currently the chair and project coordinator of the Langley Overdose Community Action Team and is a member of Health Canada Federal Opioid Council.
Good morning.
Good morning.
Thanks, Antoinette, and very glad to be here. I'm really fond of Mom Stop the Harm. it was one of the first organizations I learned about when I got into this work. And I'm just going to jump right in and share a little of my story and how Stigma has been a part of that journey, the negative impacts of it, what it is, how I experienced it. And I'm looking forward then to hearing from Dee and Katie as they build off of that. So one of the things I immediately realized around 2016 was when this crisis was declared a public health emergency in British Columbia. I had come out of addiction at that time. And when I discovered the way fentanyl had saturated the drug supply, I became very acutely aware that if I overlaid my addiction story onto this time and place, I would not be alive. And as I took a closer look at that and realized that the environment that I grew up in, kind of the values and morals that I held as a young person, or that were imparted to me, were very black and white. We're very lacking in nuance and curiosity. We're very conservative, of course, in value. Kind of drugs are bad. People who use drugs are bad people. Of course, keep in mind, and I'll draw on this a little bit more, while people are telling me this, they are holding drugs in their hand, alcohol. I think that that is something that's very important and salient for us to keep in mind as we explore the issue of stigma. So there's a lot of definitions about stigma, or for stigma. There's a lot of ways that people understand it and experience it. But, you know, one of my favorite ways of thinking about it is simply our automatic negative perceptions and judgments against a particular group. And that word automatic is really important, because my hope and kind of where I couch myself in this issue is that I need to constantly be thinking about and reassessing my own judgments. I come full circle. I was anti-harm reduction. I was abstinence is the only way for most of my life. And actually those ways of thinking were counterproductive in my own recovery journey. It took an evolution of that thinking and an understanding that I need to add nuance to the way I understand drug use. I need to add nuance to the way I understand addiction. I can't treat everyone the same. I can't put other people's expectations for me and my recovery journey necessarily onto myself. Stigma encompasses negative attitudes, stereotypes, discrimination, all these things that society attaches onto an individual who, in this context, uses drugs or may have struggled with addiction. I want to really stress that we need to separate drug use and addiction apart sometimes. In fact, in the ongoing toxic drug poisoning crisis, the overdose crisis, I think it's an error to constantly move the conversation into treatment, addiction, and recovery narrative. That is an aside issue, and we're ignoring the issue of overdose death when we constantly allow the conversation to devolve into addiction treatment. Not everyone who uses drugs has addiction problems. I've moved out of very dysfunctional addiction to heroin 15 years, but I still use drugs today. I don't have dysfunctional drug use. So we need to recognize nuance is very, very important. So question I ask myself, and one that I kind of put to you as a challenge, is how can I challenge our own preconceived notions about drug use, especially if my notions are subconscious, maybe programmed into me from the culture I have grown up in, which lead me to treat others unfairly, with unreasonable expectations, discriminating against people, perhaps excluding people. So in this webinar format, I can't really do this the way I often do it in live, but I'll ask people if they're willing to put their hands up, who uses drugs. Of course, I'm not getting any real-time feedback here. I don't know if anyone's got their hands up in the audience, but mostly when I do this, no one answers. No one really puts their hands up. Normally one guy holds up his cup of coffee and he's like, yeah, coffee, I drink drugs. But
we have 5, 7, 6, 7 people that put their hands up.
Okay, wonderful. But when I say, well, who drinks alcohol? Many more people are suddenly willing to put their hands up and admit to that. And we have a very different narrative in our culture around alcohol. But funnily enough, I mean, I think we're playing a game. I think that we've forgotten or are in denial of the fact that alcohol is a drug. People who drink alcohol are drug users. And then when I put that out there and I suggest, hey, if you're an alcohol drinker, would you call yourself a drug user openly? People balk at this. They do not like it. I think what it reveals is this way that we have internalized stigma against people who use drugs. And when people are uncomfortable to take on that label, and labels, we know, double-edged sword, and we'll talk about them a little bit more, can be very destructive. And so I know that I grew up in the drug war culture. The messaging that I received most of my life was drugs are bad, people who use drugs are bad. And so we're really hoping, my focus is to move into a conversation of nuance. And so what I would say, or where I've personally arrived, is drugs aren't good or bad. Drugs are just drugs. And, you know, we need to think about context, and we need to think about the stories of the people who use these substances. And it's historical. There's cultural factors, obviously societal factors that have contributed to the development of stigma around drug use, and the fact that we treat people so differently, and we drive them into hiding when we think of them as less than, just because of perhaps a preference or a complicated scenario in which people have landed onto using a certain type of substance. And stigma applies in so many different ways. And one of the most destructive natures of stigma is the fact that we are judging people based on arbitrary, made-up ideas. You know, when I look at the media portrayal for this crisis, that was one of the things that impacted on me very significantly in my early days of learning about this, because typically when we hear about overdose or we hear about addiction, we get it attached to imagery of, for instance, the downtown East End, back alleys, pictures of needles in puddles, and it kind of creates for us a stereotype, which we're not consciously thinking about. If I ask, you know, you to close your eyes and I say, just picture what comes to mind when I say the words drug addict. What image is there? This is your subconscious speaking to you. And we have had this image programmed into us since our childhood, because the media represents drug use really only in this black and white view. It's either extremely fun and having a great time, or you're in the gutter and you're on your way to death. And there's really no middle ground. And the middle ground is actually where all the drug use really happens, the vast majority of it. So when I look at the impact of stigma on myself, because everyone experiences stigma in different ways, and it's experienced uniquely by each individual based on their environmental factors and where they've grown up and their intersectional identity and whatnot. And considering my journey, for me, it was a massive barrier to seeking help, because I was certain that I would be labeled as a failure. In fact, that failure was my core identity. My life was driven by a shame narrative. I believed I was worthless. I believed I was never going to succeed. I believed I was a loser. I remember I would see my reflection in a mirror, and anytime I did, I would pause, look at myself, and call myself a loser. I'd say, look at you, you're a failure. You're just a drug addict. You'll never make it. And so this identity was embedded within me. And it kept me hidden. It kept me doubling down on performing. It kept me trying to look like I had it together, to be something for people that I thought they wanted me to be. And a very important fact in the way I experienced addiction was that I never became homeless. I did not become unemployed. I actually always had housing and a vehicle and worked throughout. And I think stigma was a barrier to me seeking help and getting recovery. It was a barrier to me getting into treatment, which, just a caveat, treatment is not the solution to recovery. It is a part of perhaps recovery journeys. It's not the only way people recover. Stigma corrupted my own self-esteem. It eroded my self-worth. It caused me to want to avoid employment discrimination. I experienced unequal treatment in healthcare. It slowed my recovery. All these things were factors which really I can only see retrospectively. But honestly, and perhaps the most destructive force was the internalized stigma, the judgment that I had against myself. And so I just want to put out there some of the values that I've chosen to embrace that have helped me counter stigma in my own life. Because as I said at the beginning, I'm constantly reassessing where it creeps in, where my language continues to need adjusting, where I need to improve on my own compassion and empathy for others. So compassion and empathy are tremendous values that I've chosen to embrace. And underneath all that is this curiosity, this open-mindedness of wanting to know the person in front of me, of wanting to know the story, of not scapegoating the drugs. The drugs or the addiction, the behavior, the things that we kind of obviously can see are problematic for people that might be struggling with addiction. That's the low-hanging fruit, and it's the easy thing to go after. And it's not the driver of a person's struggle. And it's not the full identity or the complete story about that person. And so be curious and be open-minded, respect people, educate yourself. So we're gonna, I think from the next two speakers, learn more about language and about inclusivity and about non-judgment. And before I pass it on to the next speaker, I want to just share a story about how language and stigma kept me from reaching out for help. So I, as I mentioned, worked and was employed, and I would be using drugs at work every day, sometimes 3 or 4 times in a day, heroin being my drug of choice. I kind of needed it every 3 or 4 hours if I was going to function. And so I'd head down to the bathroom, smoke some heroin, go back to work. Really, no one knew. I had some ability to hide it. And it was the days I did not have substances that people were asking me, "Hey, you seem off today. What's going on? You're all sweaty. You look sick." Yeah, I don't have drugs. Of course, I never shared that. Came out of the washroom and some coworkers were in a conversation, and they were looking across the street, talking about someone they'd never met, just judging from sight, the junkie across the street. And they were very disparaging in the way they talked about this person. And I felt like I was that junkie in that moment, that they were talking about me. And I knew that the secret I had was completely destructive if it was exposed. I'd lose my job, but I'd lose credibility. I'd lose whatever reputation I thought I might have had. And the power of language and the power of our words can trigger things in people in ways that we don't understand. I had this shame narrative that I mentioned that was always on the go. I'm a loser. I'm a failure. And one of the things that narrative was doing in the background was looking for confirmation constantly. It was always looking for you to say the thing to me that proved I'm a loser. And so I feel I have a tremendous responsibility to be very cautious about the way I speak to people who might be struggling. Or what if I don't even know they're struggling? I know for a fact that I interact with people who tell me they don't use drugs, and I know they're secretly struggling, because that was me. So what do I want to do? I want to be a safe person for the people around me. I want people to be willing to disclose to me their deepest secrets about the shame they feel around their substance use, because you cannot find hope or freedom in secrecy and in hiding. So I'm grateful to share a little of that journey today. And I hope maybe if it sparks some thought and some questions, I'd love to stick around and be able to answer them. And I will pass it back to Antoinette to take us to the next speaker.
Thank you so much, Daniel. Thank you for sharing your personal journey and lenses and perspectives that I think brings it all together, and how it plays out in our lives and in the lives of others. So, and I'm sure others will move to the next couple panelists, and then we'll open up for the Q&A to be able to share more. Next, we have D. Taylor John. D. Taylor John firmly believes in the power of compassion, empathy, and non-judgmental support, recognizing the complexities surrounding co-concurrent disorders. They are navigating a personal journey with a focus on self-discovery and growth, speaking on stigma and harm reduction since the beginning of their own journey in recovery from opiate use disorder in 2017. Currently, Dee sits on several boards committed to progressive awareness, education, and policy change. These include CanMed's Framework 2025, the Canadian Centre for Substance Use and Addictions Living Expert Group, and Recovery Day Brandon. They were born and raised in Brandon, Manitoba. Dee has always possessed an inquisitive nature, seeking understanding and meaning in various aspects of life. They live with their 4 teenage children and will enter their second post-secondary year in the fall. Dee is excited to speak at the Connect session. So, Dee.
Hello and welcome. I am going to share my screen because I do have a PowerPoint that I will be following. Just makes it a little bit easier for me to kind of stay focused. So I'll start with a quote from Otto Wall, which is, "Words have power. They have the power to teach, the power to wound, the power to shape the way people think, feel, and act towards one another." I'm actually going to skip this because we just did my bio, but I will be covering societal, structural, and self-stigma, as well as stigma that I see within people who use drugs and stigma within the recovery community. So looking at social stigma, starting with morality, society often associates drug use with moral failings and weaknesses, which can lead to judgments and negative perceptions of individuals who use drugs. This viewpoint is extremely outdated and actually stems from the war on drugs from Nixon in 1968, and that was carried forward with the Reagan family in the 1980s with the Just Say No campaign. This moral judgment can prevent open discussions and just exacerbates those negative attitudes. With media perceptions, Daniel actually touched on this a bit, is that they often portray people who use drugs in a negative light, showing images of unhoused people, which, yes, is a reality, but many people who use substances have jobs, homes, families. There's a statistic from Carl Hart, who is a neuroscientist and substance use expert from Columbia University. And the statistic is 80 to 90% of adults that use substances will not develop into a substance use disorder. So again, there is, that area that we don't really talk about, and it's not very present, that people can use drugs without having challenges with it. And then I love it, Daniel touched on again. I feel like we're going to have a lot of repeats, but that's just great because, it just helps us understand more, is that people, it's quite common that if somebody says or has a bumper sticker that says, "Don't talk to me till I've had my coffee," how would you feel if someone said, "Don't talk to me until I inject"? And like how those different sentences sit with your body and how you feel about that is something to explore and to look forward, with safe people within your own life. Labeling is another issue. So people who struggle with substance use disorder are often labeled with derogatory terms. It really others us. And when we other people, we focus on our differences rather than our similarities. And this can lead society to believing that people are less capable, less worthy, or even a threat. It really dehumanizes individuals, and it paves the way for mistreatment and misjustices, because if we're like, "Oh, no, they're this way, we have a right to treat them poorly," And also by using person-first language, we really can focus more on the individual rather than the condition that they have, and just has a more positive perception and challenges the negative assumptions and biases that we all live with. I wanted to include families and social stigma as well, because there's a lack of support in Canada for families of individuals. If somebody in your family or one of your friends is using substances, and that's just not the case for other physical ailments. Like if someone in your family gets cancer, there is lots of supports. I do want to note that there is supports for families, like Mom Stop the Harm has their group, but these are often nonprofit organizations and are not integral parts of our healthcare. So that in itself makes a statement. Moving on to structural stigma, the two main contributors to this are drug policies and criminalizations. So strictly punitive drug policies often neglect the underlying health issue related to drug use. I do want to preface that with not everybody that uses drugs or struggles with drug use has an underlying health condition as well. But this brings stigma and can prevent the individual from reaching out for help. And this isn't just drug policies that are, laws, it's also within the workplace as well. And just this lack of dialogue can really hinder sharing and accurate information and innovative solutions. Like if Daniel was able to talk to his coworkers about his struggle and it was a more commonplace in the workplace, we might have more ideas on how we can keep ourselves and our community safer. Looking at criminalization, it is one of the major contributions to stigma. People are labeled as criminals simply for using drugs, and it just helps reinforce the negative stereotype and making it harder for people to seek help, and they have fear. So again, touching on that, you're okay with people drinking alcohol, like, mom hasn't had her wine yet, sort of thing, but it would just, how would you feel if, again, like I need to smoke meth before I do this, and the way that we perceive that in our own minds and how different it can be. This stigma the stigma associated with having a criminal record for drug-related offenses is really challenging for individuals and can make it hard to reintegrate into society. Not taking people who use substances seriously or connecting them with services. This is something that I personally experienced as an individual with co-occurring disorders. We'll see that an individual needs to be sober to seek help. So bipolar, for example, they'll need the individual to be sober to enter in a mental health facility, but in fact, that person might be using drugs to self-medicate. And if they got help for their bipolar, then the use would become less problematic or possibly subside instead of the other way around. And then just simply designing services that enhance stigma. Again, this is something that I've experienced through a friend with the local crisis unit. I'll share their story with their permission. They were feeling very unsafe on a Monday morning. They said, you know what, I'm not doing well. I feel like I need to be with people. I'm feeling very unsafe. So they went to the crisis unit and they self-disclosed that they had used meth the Thursday prior. And the nurse said, no, I'm sorry, we don't have what you need here, and I don't know where you can go. So I do understand that there are healthcare issues that I understand that there's issues with detoxing in healthcare, but it is inhumane not to have an option for individuals who are struggling with both mental health issues as well as challenges in and substance use. I am going a little fast than I normally do, so I hope that's okay. I just want to make sure that I get all the information and give everybody a chance to talk. So looking into self-stigma, Daniel really talked about this and touched on it a lot, which I really appreciate because that is a major contributing factor to just increasing problematic use, or at least it was for me. That internalization. Individuals who use drugs may internalize the societal stigma and that emotional impact of individuals who struggle with drugs. Just really internalizing that negative societal perception and feeling ashamed. This can really lead to an emotional burden of low self-esteem, depression, anxiety, and decreased sense of self-worth. I always think about, if society thinks people are shit and then they think they're shit, what are their actions going to be? How are they going to act? Like, this was definitely something that I really internalized with opiate use disorder. We're told it is so hard to come off of. And I really internalized that for many years, thinking that it was no use and that I would always be that way. So really hindering the help seeking. So we see this not only for individuals who are seeking help for drug use, but simply any healthcare need. They tend to really pull away, fearing that they're going to be judged from healthcare professionals, their friends, their family, and such like that, even when it's not seeking help for their substance use issues, as well as isolation. So that self-imposed isolation, that others distance themselves from others to avoid potential judgment and the negative reactions. And that just exacerbates the feelings of loneliness. So it's important to recognize that self-stigma is a deeply ingrained issue and that it may take time to overcome. Creating an environment of understanding, empathy, and support is essential for everyone to break free from this self-stigma and to move towards personal growth. And before I go, my last slide, I just want to touch on sometimes stigma that happens within people who use drugs. And so I kind of commonly hear this within my community, the methods of use. So I only smoke meth, so I'm not like those other people that inject it. And I feel like those type of thinking and that way of thinking, again, just really separates us, and separation and disconnection is really a perfect driver for more problematic drug use. We also see major disparity between crack versus cocaine. Lots of cocaine users will say, oh no, I don't use crack, so it's way different. And this actually stems from the Bipartisan Anti-Drug Act of 1986, which put crack at 100 times more. I always try to figure out the best way to explain this. So if you're caught with 1 gram of crack, you will be charged with the same amount if you were caught with 100 grams of cocaine. And I think it's really important to note that these substances are almost chemically identical. So that's important to note as well. Also, something that I've experienced is stigma within the recovery community. A lot of people still think that recovery is abstinence from all drugs and substances. And it's really important to note the definition of recovery, and that recovery is not synonymous with abstinence. So the definition is recovery is the ability to participate fully in one's community and live a productive life. So again, sometimes individuals will say to me, well, because I still use substances, both legal and illegal. And I've been told, well, no, you don't fall into recovery. And I say, ask my family, ask my children, ask my job. I am much more present in my life. Even though I still use drugs, I am not using the drugs at the problematic rate that I was before. And, everybody in my life is just so much better from it. So, yeah, that's all I have. So I'm just going to stop sharing this and we'll let Antoinette introduce Katie.
Thank you so much, Dee. You gave us tons of food for thought, the structural pieces and how that ties in with criminalization, supports within healthcare or, things like that, and how stigma shows up in various places, as well as thank you for sharing, some of your personal things that you've come up against as far as with stigma and how that's impacted. So thank you. And Katie, so Katie Upham is a person on prescribed safer opioid supply and represents Atlantic Canada on the board of directors of Bum Stop the Harm. Katie also volunteers for the National Overdose Response Service, which is known as NORS, as a phone operator to spot people as they use drugs over the phone. She uses her own experience with injection drug use to advocate for change in healthcare settings, drug policies, and other structural changes to our current systems that support the rights of people who use or use drugs. She strongly believes that people who use or used drugs must be justly included in all practices, programming, and guidelines that concern them. Welcome, Katie.
Thanks, Antoinette, and thanks, Daniel and Dee, for your excellent overviews on different aspects of stigma. I could relate to a lot of what you both said. Yeah, so as Antoinette mentioned, I am a person who injects drugs, and I'm on safer supply, and my lived experience is really relevant to today's talk. So I wanted to mention, I often say us in my talk, and what I mean by that is people who currently or formerly use drugs. So I thought that now that everyone has a good understanding of stigma related to substance use, I could talk about what we can do about this stigma. So one of the ways we can combat stigma and even dispel some of the common myths about substance use is through the use of person first and compassionate language. So person first language, which is used to recognize that first and foremost, we are people and shouldn't be identified by a label that refers to one particular behavior we engage in. So saying people use substances or people use drugs are examples of people first language rather than using harmful labels like addict, junkie, crackhead. We all know them, I think. Another appropriate way to refer to someone is a person with lived or living experience of substance use. I personally prefer to say I'm a person who uses drugs over having lived experience because I think that's the clearest way to talk about my experiences and avoid some confusion. There are a variety of different lived or living experiences, and some people who have loved ones who use drugs consider themselves to have lived experience because of their loved ones' use. And also, I just try to own the fact that I use drugs and not be ashamed of it. And I find that's the best way to do it. And again, unless you're talking about your own experiences and yourself, it's best to avoid using words like clean and sober and replace it with someone who is abstinent from drugs or alcohol or someone who's in recovery. Personally, I try to avoid using the word addiction just because it's an outdated term. It's now referred to as a substance use disorder. And addiction can also lead to the shortened addict label. You could say a person with substance use disorder, but only if that person has identified that they have been given that diagnosis or if they've used that language to refer to themselves. So we don't want to be diagnosing people either just because they use substances. I know others have talked about that there's a spectrum of substance use from complete abstinence to recreational or occasional use, all the way to the other end of the spectrum, which would be more problematic use. And it's not our place to judge someone else as fitting a clinical diagnosis. Just because someone uses drugs does not mean they have a substance use disorder, which has been said. I've been diagnosed as having an opioid use disorder, but I hate that label for myself. And I don't like that society pathologizes substance use as a disorder. So I just don't use that language to refer to myself or anyone else personally. When it comes to urine tests, try to say positive or negative test result instead of saying clean or dirty. Same when talking about drug using equipment, a sterile needle or used needle, saying that is much less stigmatizing than saying a clean or dirty needle. Should also avoid using words like habit or abuse, just because those words suggest there's a lack of willpower involved or a defect in somebody's character. And I came across studies that found that when the words abuse or abuser are attached to a person or behavior, they're much more likely as to be seen as socially threatening or in need of punishment. So there are moral connotations to these words, which is why they need to be avoided. And along the same lines, we should refer to drugs as being illegal or unregulated rather than illicit drugs. The word illicit also has moral connotations. So I think about the term illicit affair and the implications that the word illicit has in that phrase. It doesn't bring up good images. So the same idea when it's paired with the word drugs. And I wanted to discuss the word overdose versus accidental drug poisoning. So overdose suggests that somebody ingested too much of a particular substance, suggests that they knew exactly what they were taking, knew their tolerance level, and that they purposely took too much. Because some substances are criminalized, people don't have access to the information they need in order to know how much they are ingesting and what is in the substance they are taking. Because alcohol is legal and regulated, we can walk into a liquor store, pick up a bottle of alcohol, and know the percentage of alcohol it contains. And of course, the same is true for cannabis now. But for unregulated drugs, we do not have access to the same information about what we are consuming. Therefore, someone could take a very small amount of a street drug and still be at risk of fatal consequences as a result. Therefore, accidental drug poisoning is much more accurate, and it shifts the blame away from the consequences of the individual, and it puts it where it should be, and that's on the harmful consequences of our current drug policy. Next, I wanted to be really clear that the accidental drug poisoning deaths are not an opioid crisis. It's a crisis of bad drug policies. It's a lack of drug regulation that's causing this crisis. We hear about it in the news. I read about it in research articles sometimes too, that the deaths we're seeing from people using contaminated street supply is being referred to as an opiate crisis. And I think it's actually dangerous to call it this because people may then think that as long as they don't use street opiates, that they're not at risk of an accidental drug poisoning. And the truth of the matter is that stimulants like cocaine are now laced with more than just opiates. They're laced with benzodiazepines and other contaminants that are killing people too. Any street drug could cause an accidental drug poisoning, not just opiates. It also neglects the fact that most fatal drug poisonings are from a combination of multiple substances. Polysubstance use is increasingly present, and for most people, the days of having one preferred drug seems to be behind us. I've also heard people refer to it as an addiction crisis, which again, it's not an accurate description of the crisis, and it's very misleading. The problem is not that more people are addicted to drugs. In fact, people use recreationally occasionally, or people using drugs for the first time are at the greatest risk of experiencing the most harms from the toxic drug supply because they do not have a tolerance to the powerful opioids, benzodiazepines, and tranquilizers like xylazine. Therefore, this important distinction is a good example of just by how shifting our language, we can dispel some of the myths out there about substance use. And how can we effectively deal with the crisis we're facing and address the root causes if we are mislabeling what's happening? If people think it's an addiction crisis, they will believe all we need is more recovery-based services. If we label it accurately as a crisis of unregulated drugs, the solution becomes clear that people need access to a regulated, untainted drug supply in order to stop the deaths. I also wanted to talk about some compassionate language that we can use too. As was mentioned, I volunteer on the NORS line, or the National Overdose Response Service, and I heard other NORS operators using the term connection-seeking behavior rather than attention-seeking behavior, and it really stuck with me. I've had my behavior labeled as attention-seeking by healthcare practitioners before, as well as by loved ones, and it's really hurtful. It dismissed my very valid feelings. It produced a lot of guilt and shame for me, and it made me question my experiences, wondering if I was exaggerating. And it is also much more accurate. When people said I was attention seeking, really I was seeking connection with other people. I was seeking to be understood, really heard and seen by fellow human beings, something we all need to feel good. Using that term, attention seeking, to describe me made me feel the exact opposite of what I was really needing. I felt more disconnected. Also, I hear people being described as unmotivated or non-compliant or treatment resistant when talking about their presumed, I guess, failure with certain substance use treatments. And I think that saying person experiencing barriers to accessing services is more compassionate and more accurate. To illustrate this, I heard a quote by an anonymous person who uses drugs that I wanted to share with you. What if instead of talking about hard to reach people, we talk about hard to reach doctors, or hard to reach services, or services with dumb barriers or restrictions to access, or a system with shitty attitudes? I loved how the perspective was flipped in favor of people who use drugs. There is a need to stop centering this medical morality in the language that's used to talk about us and use more compassionate language. Also wanted to mention a term I first heard from Gord Garner, I think is his name, from CAPSA. He talked about substance use health, and I really liked it. He explained that in healthcare, we talk about mental health and physical health, but our substance use health is also one of the key factors contributing to overall health. It would be so nice if we could go into our doctor's office and feel comfortable openly talking about our substance use health and any concerns we may have about it. I think that I would be more likely to talk about my substance use with my doctor or my loved ones if it was framed that way. Another phrase I would like to see people avoid is drug-seeking behavior. The main problem I see with this kind of labeling of someone's behavior is that it often produces this tunnel vision in health, especially in healthcare providers, so they don't fully investigate someone's medical concerns. People have been turned away from emergency rooms often, this happens every day, only for there to be serious medical health complications as a result. Labeling someone's behavior this way is a perfect example of stigma. I have had a loved one label my behavior that way in hospital, and it was really hurtful. So if you could avoid saying someone is drug seeking, that would be great. I think that when we stop judging people's behavior in that way, we'll be able to see that they have those real valid medical concerns or real pain. And emotional pain is pain too. Physical pain is one thing and needs to be addressed, but people have emotional pain and they need our empathy and support, not our judgments. And plus, why, like I was thinking too, don't we all drug seek? Like, isn't that why we go to see a doctor in general? Like, it's usually because we need a medication to be prescribed. So I find it ridiculous that people get labeled as drug seeking in the first place. For me, part of the healing process from self-stigma has been taking back some power over my life in this regard and to speak up about how I want to be referred to in terms of my substance use. I feel it's important to correct people who are ignorant to how it affects me. I was interviewed for an article on the COVID-19 pandemic and how there were increasing accidental drug poisonings in Nova Scotia last year. And I made sure to give them a non-stigmatizing image to use as well. Like, we see those images every day of people, like they're right on the street corner and they're dirty and they look like broken and bruised basically, and they're injecting drugs right on the street corner out in the open. And that's just not an accurate portrayal of substance use. A lot of people are dying in their homes and some in very nice homes. So even what may seem like small changes in language or images can have a big impact on myself and others. And while it is work to learn using this language, I've found it really empowering. I also wanted to mention that when it comes to you and your own experiences, that you can use whatever language you want. I still think that, it contributes to internal self-stigma when people use terms like addict to describe themselves, but that's them. They can, talk about themselves in any way they want to. Even if, Daniel, for example, calls himself an addict, I would still not do that because I just don't want to perpetuate any stigma myself. Sorry, Daniel, just using you as an example. And correcting people who use stigmatizing language is a great way to be a good ally to people who use drugs too. Speak up if you hear friends or colleagues using stigmatizing language or judgments. Try to challenge their views in a kind, patient way. That tends to be more persuasive. Even how healthcare providers write in a patient's chart can enhance or reduce stigma. So if you're in the field of healthcare, just please reflect on how you talk about patients in all aspects of your job, including in written form. So in closing, I want to say that language in this field is constantly evolving, and stigmatizing language has been really ingrained into us by society. So it takes time to shift our language. So be kind and patient with yourselves too. It won't happen overnight. Thanks.
Thank you so much, Katie. So many good points that you were able to share with everybody on the lenses and perspectives and how to change things and how it shows up. And listening to all of our speakers today, people won't necessarily know that we did not pre-share what each speaker was going to say, although each speaker kind of got a little bit. One of the things that I noted was all of the speakers talked about having empathy, and so everybody noted that in their share, and there, as Katie alluded to, there was some overlap, but just talking about it from a different perspective. And I think for me, I know for me to change my language, to change my behavior, I need to hear it a few different ways and just to hear it. So I also want to encourage those that are out there that to be kind and gentle and have empathy for yourself as you're learning a new language. I am going to start going through some of the questions that came through the Q&A. One of the things before I do that is, and I'm not sure if it's in because I'm not following that right now, I'll pull it up in a second. This is something that we have not previously asked our panelists that has come through, is if the panelists would be willing to share their email contacts with people, so that if people do want to email you or do any follow-up, that you would please put that put that out so that people can contact you outside of this. And I'm just going to go to thank you. Tyler's been fervently transcribing behind the scenes to bring up the different questions, and I'm just going to start going through some of the different things that were shared and said. I am going to, and I don't know, one of the questions was to enable the chat. And so I'm not sure, Tyler, with you being a co-host, if you're able to do that or if I need to do that. If you could do that. Okay, so questions. I believe that there is a style guide for journalists that has been widely accepted. So how do we provide guidance to them around the all too frequently used loaded word abuse when we're discussing substance use? So I think, Daniel, you were going to take this one.
So the Associated Press style guide has explicitly stated that the word abuse should not be used in this context. But that doesn't mean journalists know this or read the style guide or have updated their way of writing. So what I do is when I see it, I email them and I send them an excerpt from the style guide and I say, hey, this story should be updated. It's using stigmatizing language that we don't use anymore. Sometimes they reply, sometimes they change it, sometimes there's no reply. So, I think this is one of the advocacy things that we can take on, that people can do in the background. There's no glory. You email a journalist and they completely ignore you, but it's the hard work that really needs to be done to drive change. And I think one of the things that I've come to accept, although I wrestle with all the time, is that the change like this will take time, like a generation or more. And when you know that, then you don't have to be discouraged when you're ignored or there's no reply. Be persistent. My local paper, Langley Advance, still from they're using image. I know the reporters. I talk to these people. Still an image, stigmatizing images show up attached to stories constantly because they're lazy. It's file photos and lack of understanding. And so just constantly email people and tell them, and be kind when you do it, because they don't know.
Thank you. Thank you.
And I had to work on the kindness part. I'm still trying to improve there.
And what is the guide again? You mentioned
The Associated Press has a style guide. So I know that that's used in most journalist outlets in America, not as much in Canada. But, you know, it's like Black Press here in British Columbia. They don't abide by that style guide precisely, but many journalists recognize it as the standard. And so if you point out to them that they're violating it, you know, those that really care will make adjustments. So it happens slowly, right?
Thank you. Thanks, Daniel. Next, this one, you know, and some of them are specific to panelists. We want to give an opportunity for all the panelists to give some feedback. So this one is for Dee. Would you please repeat the definition you gave for recovery?
Yes, I can. And this definition, oh gosh, I tried to get all my references in order and I did not. It is from a Health Canada segment from like 2012, believe it or not. So recovery is the ability to participate fully in one's community and live a productive life. So I'll also type that into what I believe is the question and answer. And I know I saw a couple people asking about a physical copy of like what words to use. This one's for Antoinette and Twyla. CCSA has a language primer, and I find it a very good one. So I do have it saved to my computer. So I'm not sure if it would be appropriate to share it in this way, or if we want to maybe just connect through email afterwards. So.
Okay, thank you. And then many thanks, Dee. I feel my heart opening and connecting to my own stigma and that of others, as well as seeing myself in those around me that I may have previously stigmatized. So some of these are just comments for panelists that
and I actually see that Diana has posted that the primer, the language primer, right in the question and answer.
Yes.
So
we're going to stick with the questions before we go to the rest of the stuff, just to make sure that we can get through, you know, all the questions. So in the chat, I think, Tyler, have you enabled the chat, and that's why people are able to see things? Yeah.
It's actually not allowed. It's not allowed me to enable it for everyone to be able to communicate through it. But I have been capturing everyone's comments, forwarding them on to Antoinette, so she has the ongoing list of comments and questions. And if it's been directed to a specific panelist, then that's also been included in the notes that I've been sending to you. I'll like with the recording, as well as the email addresses of our panelists, and that then we will include that, as well as the any documents that are referred to today. We can include in that follow-up email for everyone.
Thank you.
So definitely just post in the Q&A, and I'll make sure we we capture it going forward.
Thank you. Katie, you have your hand up.
Oh, I was just going to say, I also posted an infographic that I created on language and stigma, and folks can download it if that's at all helpful. Thanks.
Thank you. Thank you. Okay, for Daniel, you can't feel hope and freedom in shame and hiding. Powerful statement. Thank you. Daniel, this is for Daniel. Thank you, Daniel. So much food for thought and action here. Okay. Okay, so this is opening up to the panelists. So, you know, whoever feels, what would you say to someone who says, confession, the only reason I'm ashamed of using drugs is because I'm underage?
Interesting question.
So I noticed there was that pause.
I don't remember being underage so long ago. Dee, do you have a thought on this?
no, I just had a relation to it because I did seek help through NA when I was about 16 and really faced stigma with who was running it, saying, you guys aren't even old enough to, you know, drink alcohol or use drugs. And that always stuck with me. Like, that is more than double my life ago. So yeah, unfortunately, I don't exactly have an answer, just a relation that this is something that's common.
Yeah, and I think that the response would be about trying to push a little deeper and see really what the root is there. Like, what is the fear that that person is afraid of being? Is it the fact that they won't get the support that they really want? Is it kind of the social group around them that they feel is going to be, there's a higher level of consequence or rejection attached to exposing that? So what they really probably need to do is find a safe space to share that, and the support groups that you have around you aren't necessarily always the best or the safest. And so, yeah, that's kind of going to be the challenge, right? For someone who's young. And here in Langley, we have the services of the Foundry that work with youth, and they create that safe space, which wouldn't necessarily mean that immediate loved ones or family need to be a part of that conversation, especially if they're contributing to stigma in a negative way.
Thank you. I'm just scrolling through here. Okay, so I think this one, it says, love Katie's presentation. Is there an acceptable term for an episode of accidental drug poisoning or toxic drug event? Overdose is used regularly and isn't accurate, even as we are about to mark International Overdose Awareness Day.
Sorry, I sort of missed the question there. What was the question?
So, the comment is, loved Katie's presentation. Is there an acceptable term for an episode of accidental drug poisoning or toxic drug event? Overdose is used regularly and it isn't accurate, even though we're moving into International Overdose Awareness Day. So what would be the acceptable term to use instead of that?
Yeah, I guess I was confused because they used the appropriate term in that statement. Sorry. So yeah, like I personally, I feel that accidental drug poisoning is the appropriate term to use, unless somebody like purposely took too much of a particular substance, and people do that, like people overdose. That would be, then we'd use the term overdose, right? Where people know how much they're taking and they take too much. Yeah, but we know that the drug supply is just so inconsistent and how strong it is, and so people are accidentally taking too much, and so that's why we say it's an accidental drug poisoning. The other term, there's another term they used in their question, and I thought that was accurate as well. That was great. It was like a toxic drug event or toxic poisoning event. That's great. Yep, I think it sounds like they have a good understanding, honestly. Thanks.
Thanks, Katie. Dee, you have your hand up?
It was actually just to touch on that as well, using the term of toxic drug supply, because again, that is something that happens where someone believes that they're using a particular substance, but it has been cut with something else, and they're using the same amount that they normally do. However, they have an overdose due to toxic drug supply. And then, like Katie touched on it as well, there are individuals that die by suicide by means of overdose, and that is a death by suicide.
Thank you. It's so important on the language that we use and how it's, shared and conveyed. Going back to the chat, or lots of thank yous for each speaker. So I think Tyler was probably instead of putting everybody's individual, just lots of thank yous to all the speakers. Can we get a PDF or a list of correct terminologies emailed after the presentation and webinar? I think we talked about that already. Katie mentioned the one that she has. Dee mentioned the one that CCSA has. So there are ones out there, and we will include those afterwards when we send out. We can send that out afterwards. Is it possible to get a written page of better language to replace? Okay, so the same thing, I'm just noticing in the chat, better language. so often faced with. I think we really need to practice using these terms. I think that's a really good point. I know for me, when I became aware of language, and I needed to practice and catch myself, you know, and I was very intentional about changing my language. So I think that's something that, you know, just to be aware and just to have that compassion for yourself. So really looking at what is the language. And so it is good to have kind of like a cold notes version, which we've already referenced, that will be shared out to people. And then the next, D.
Sorry, I just wanted to jump on. I don't know, because Evie, their question got dismissed. So I don't know if we were gonna go to that one or not. Yeah, okay, okay. Then I'll
Yeah,
just-
what Tyler is doing is taking the questions out of the Q&A and moving them into the chat for me. So
Okay, perfect.
yeah. So absolutely, there won't be anything missed. They're just moved out of there into the other. I think probably it's logistics, keeping track of what's been, you know, said, etc. So can we include the panelists' email addresses when we send out the link in the recording? We've said yes. We should remind that today, well, just reminding everybody that today is being recorded and will be put on the Mom Stop the Harm YouTube channel, uploaded. That's the word I was trying to come up with talking about language. Uploaded to Mom Stop the Harm YouTube channel, as well as any documents and panelists' emails will be shared in follow-up emails. Okay, so all speakers mentioned about self-stigma and how that hampered the recovery. How do you help a loved one overcome this?
Okay, this is a fantastic question. Thank you, Linda. I have some thoughts. So one of the messages that I heard in early recovery a lot was that once an addict, always an addict. And first of all, I'd say that that statement is fundamentally untrue, and that we need to completely, you know, just do away with that concept. It doesn't make any sense. It's not backed by evidence or research. People overcome addictions all the time. In fact, research shows that the vast majority of people that experience addiction, substance use disorders do overcome them, and without treatment even. And this is very interesting insight into the underlying causes of what drives problematic substance use. It's not the drugs per se. It's core and deeper root issues. So when I look at the self-stigma that was keeping me, that was really perpetuating a destructive addiction cycle, one thing that attached to it was from the expectations for what my recovery should look like from people in my sphere of influence. So particularly family, essentially prescribing to me how my recovery should go. And I think that this is historically how we've treated people who are struggling in this way. We tell them what steps they should take in order to get better. And that has been very reductive. And for the most part, go to treatment, become sober. And that's end of story. And for me, that was a big part of the expectation that I got from people around me. So I was either, I was not doing good unless I was sober, period. That was the kind of perception that I had from people around me. And so how did that hamper my recovery, and how do we help people overcome this? We give them agency. We get curious and we ask them what we present to them a smorgasbord of options in terms of improving their lives. And perhaps abstinence is part of that. Perhaps that individual is interested in abstinence or is aimed at abstinence, wants to pursue that. But perhaps that idea is so overwhelming that it freezes them and they actually do nothing instead, because the idea of going from a very expensive and destructive opioid habit daily to being abstinent tomorrow, it's impossible. It sounds impossible. It sounds so overwhelming that there's no point in trying. And so one of the areas that I was hampered, let's say, was ideological beliefs about what recovery should look like. For instance, I started exploring perhaps I should pursue opioid agonist therapy. Perhaps I should take Suboxone. Maybe that would help. Oh no, that's not recovery, I was told. That's replacing one drug with another. You haven't improved anything. And that ideological belief around how I should recover, and if if harm reduction is a valid principle, or if I should pursue this, they weren't options on the table for me. That agency had been taken away from me. So I was boxed in by my loved ones, describing or prescribing to me what precisely my recovery should look like. When I shook that off, when I shed that, when I said, forget it, trial and error, I'm pursuing my own journey. And I found people who empowered me and gave me self-agency and asked me questions from a place of curiosity to help me improve my life and pursue recovery by the description that Dee has given us today, where sobriety or abstinence, let's say, is not a definition of recovery by any means. I mean, I know a lot of miserable sober people who don't have good lives, aren't happy and don't have joy and aren't living fulfilling, meaningful, purposeful lives. And so that idea, those concepts of meaning and purpose are the things that I want people to be embedded in their hearts. So those are the things that they're pursuing. And I think when people pursue meaning and when they pursue purpose, if there's dysfunctional drug use and other things in their life, those things will begin to line up over time, because this is the journey of life for all of us. We think of addiction as confounding and baffling. That's language I don't like, and it's used sometimes. And I don't think addiction is confounding or baffling at all. I think it is a normal human experience that virtually every single person can relate to. And we need to kind of take some of that mystery out of it and give back agency to the people that are struggling so that they can define a pathway forward.
Thank you. I noticed that Dee and Katie, you both have your hands up. And so I'm just going to put this out there because we have a number of questions and comments still that we need to get to. So I will invite you to speak, but if you could keep it concise to make sure that we can get to all of the questions we currently have. And so Dee, if you want to. Sure.
Okay, I'll try my best. Just touching on, like Katie said it before, no matter how somebody labels themselves, using that language that you know is right. And I'll tell a quick story about my detox or my withdrawal. At the time, detox was not available withdrawal support services were not available. So I actually detoxed on my mother's couch. And 2 days in, when you detox from opiate use disorder, it's a very severe flu-like. And I remember I was so sick, and my mom got me a cloth cleaning on my puke bucket. And I looked at her and I said, "Why are you helping me? I'm just an addict." And she said, "I don't care. I don't care if you go back to use," because I also said I'm going to go back, because it wasn't the first time that I had detoxed. And she said, "I don't care. You're worth it. You're worth it in this moment. You're going to be worth it forever." And sorry, I always think that that is a major contributing factor of why I was successful that time, because I can still think and I still know the feeling that I had that somebody cared about me, that someone took the time to care for me, even though I myself did not think I was worth it. So you don't know the impact that you make with people just by caring for them.
Thanks, Dee.
Thanks, Dee. That's a really powerful story. I just wanted to mention, which Daniel talked about, the stigma around methadone, Suboxone, and those replacement therapies. I was a smoker for 15 years, and in January, it was my New Year's resolution, I quit, and I've been chewing Nicorette gum. Everyone has congratulated me, and no one is suggesting I stop my Nicorette gum. People are so excited chewing Nicorette gum, and I have no desire to stop. I might chew that gum till I die. I love my Nicorette gum. But just the contrast, and it's exactly the same thing, you know, a street opiate versus then getting on methadone, Suboxone, safer supply, the exact same thing. You know, my employer is not asking me to stop chewing my Nicorette gum. Like, so that to me is just such a good example that the different responses there. And the reason is because of the stigma, because opioids are illegal. Street opioids are illegal. That is the only difference. So if you put it in that perspective, please don't pressure your loved one to come off of opioid replacement, because I have been, and it's awful. You know, love them where they're at, and you know, it should be up to us to decide, you know, what's right for our body and our quality of life. You know, that should be the measure of success, what I define as success for me and my quality of life. And my quality of life is good. And I'm injecting drugs every day that are prescribed to me. I'm very present here and I'm able to work and participate. I'm good, you know. I don't have to worry about dying from, you know, injecting street opiate. So
Thank you. Thank you, Katie. The next one actually moves right into, and it fits exactly into what you were just sharing, is the comment I'll do first, and then if you can respond to this. Absolutely moving presentation. I learned a great deal from all of them. I have experienced that stigma and shame when I was with my adult son who was asking for medical help in a healthcare system. How does one get safe supply from a doctor? I just figured, Katie, that would, you know, you've talked about being on safe supply, that this would automatically be up your alley. So
yeah, so I am on safer supply. That is a great question, and that is the problem, and that's what we're advocating for. It's not easy to get on safer supply. And so I would say, I don't know where you're at or your region, but investigate. There's likely a safer supply program around you somewhere, but it could be hours away. I honestly, I was just lucky because I worked in harm reduction. I knew doctors that could help me when I decided that I didn't want to be using street drugs. So, but very likely you'd have to get on a wait list. So if you or your loved one is looking for that, NORS could help you too. Like if you call NORS line, like they'll also direct you to resources in your area. So if you were to ask, then like for a nearby safer supply program, they could probably look that information up for you, but very likely you have to get on a wait list. And they normally prioritize the most equity deserving folks. So, you know, folks that are street entrenched and that kind of thing first. But that's what we need. We need more doctors willing to prescribe safe supply. Thanks.
thank you. I think that families may have internalized stigma as well. I found two words that have been very harmful in my attempts to find help are codependent and enabler. I find these words are judgmental, laden with harmful to both families and loved ones. I find that many therapists still use these labels and outdated concepts. Any thoughts on ways to challenge these labels? And I'm watching the time, so I'm going to really condense this. And I think I'm just going to jump in and respond to that. If anybody has one or two sentences, because like I said, we only have a few minutes left. We still have a couple more things to do before we wrap up. So
I'll just point to a resource. I won't answer the question, but Maya Salovitz has done great work on this area, and you know, kind of essentially debunking codependency, and the community resilience and family training craft. There is a book called Beyond Addiction, How Science and Kindness Help People Change. Those would be my recommendations so that we can do away with these concepts of codependency and enabling.
absolutely.
And I'll just jump in too and say that Mom Stop the Harm, they actually did a Q&A 4 months ago with Keith Carpenter, PhD, about codependence enabling. So to just plug Mom Stop the Harm a little bit more there.
Absolutely, thank you. Yes, the Center for Motivation for Change, which wrote the book Beyond Addiction, we did a connect session with Dr. Ken Carpenter, who is their lead trainer, and specifically it was around those terms. So if people want to check that out. Okay, comment. Exceptional speakers. Thank you for sharing your real experiences. You really, you are really creating, you are really helping to create understanding that many people rely on medical supports. Medical supports to be able to participate more fully in daily social experiences, etc. Everyone should be able to access what they need in a safe, non-judgmental way. Thank you for all of your contributions. Okay, so this one, and I think there's one more after that, and then we are going to wrap up. This one's D. I love that you shared your PowerPoint. Lots of food for thought for me. I'm sorry, though, that as a young adult, that stigma from a person's from NA. However, it was that person, not NA, that made such a bad tasting statement. It's horrible, but it's not a NA. Please I hope you can realize that somehow that groups do wonder with people seeking help and traditions. And hang on a second.
Well, while you find it, I do want to say, yes, I could have just said add a group. And yes, I do know that NA is very successful, and I did return to it in adulthood as well. So thank you.
This might sound ignorant. It is a sincere inquiry. I'm wondering what the best non-stigma description for someone openly using drugs on the street looks like. They are in danger. I may have my own answer to my own question.
Do you know their name? Just use their name.
Thank you. Yeah, thank you. Comment regarding youth not feeling able to share their drug use in safe environments, which restricts their access to resources, is something advocates and supporters can work on by normalizing conversations around drug use within their communities and within school systems. We need to actively work to change the narrative, which will reduce the stigma for everyone, youth included. We need to make sure that the supports are in place for youth. We educate youth on alcohol and tobacco use both in home and school, so we need to expand this education to include other substances. Youth need to know how to use substances safely while in the same time knowing where to go for help. Okay. And I'm just kind of scrolling back through to make sure that I haven't missed anything. I think Dee, you had mentioned Evie's question. Has it been addressed? Yes, okay.
Yeah, it was the codependent enabling. Yeah.
Okay, perfect. All right. Wow. Lots to think about here today. Lots. Thank you for everybody that joined us. Thank you so much to our panelists for being so transparent with your lives and opening your hearts and your expertise with us. This has been just an amazing morning. Well, for me, it's morning, moving into afternoon. I guess it depends on where you live. Just incredible different lenses, perspectives on the same issue. And I think, you know, one of the things is to take hope in that we're having these conversations, we're bringing these together. We have people that are interested, you know, to come here and to listen to and to share and to support one another, and how we can make a difference in this world and how we can start to change the narrative and the language, because it is about people and is about, I loved your last comment, Daniel. What do you call somebody? By their name, right? Like, so thank you, Daniel. Thank you, Dee. Thank you, Katie. Thank you, Tyler, for, you know, doing all the background stuff. We just want to thank everybody for the time that you spent with us and sharing. And just note that this will be available again on our YouTube channel. And I wish everybody a fantastic day. Thank you.